Imagine this. You've been feeling some pain for a while that you've been putting off because you're scared of going to the hospital. But at one point, the pain gets so bad, you've ended up in the AR. It takes over 3 hours for someone to come by and assign you a doctor, and another 3 hours until you can actually meet your doctor. After assessments and tests, it turns out you have appendicitis, and it's severe enough that you're going to need surgery. The doctor and nurse explain your diagnosis to you as you fill out a consent form, as well as numerous other medical forms. And it all explains the surgery in important detail, but you don't really understand it due to the medical jargon. You want to ask for more reassurance and details, but there's not really anyone available to answer your questions. And truth be told, you're in so much pain that understanding this consent form is the least of your worries, if it means the pain will stop. This is a common scenario that patients in Canada often struggle with when dealing with the healthcare system. Informed consent is defined by permission granted in the knowledge of the possible consequences, typically that which is given by a patient to a doctor for treatment with full knowledge of the possible risks and benefits. Now, hospitals can be a scary place, especially when you're being told you have a certain medical condition or that you're going to need surgery. However, for people with disabilities or language barriers, this is an even bigger mountain. Like the case we discussed in class regarding the absence of sign language interpreters for deaf patients, it's been highlighted in the past how important it is for your quality rights under the Charter to have fully informed consent. But when the system is under so many constraints, there are many gaps in patient knowledge that cannot be addressed. For example, the lack of primary care doctors to take the time of assessing a patient and knowing their medical history, some backed up procedures and long wait times, and the existing healthcare workers struggling to stay afloat with their own workload. Informed consent is a basic concept of autonomy-based medical practice. However, the comprehension of an informed patient is so low that it is questionable how viable and genuine patients' wishes often are. We see a lot of surveys where patients fill out medical forms and don't even recall or understand the information they just filled out. My truthiness and many other people's truthiness is that as patients, our informed consent is very limited in knowledge. We may consent to procedures or medications because we don't know what other choice we have, and sometimes there is no other better choice. However, the way our healthcare system functions today makes it even more difficult to process or learn about the extent of our medical conditions. Unfortunately, for people like in the Eldridge case, or people whose first language may not be English, or individuals who can't read and comprehend fine print medical jargon, we risk patient autonomy of making fully informed decisions regarding our health.